Hello, everyone. Welcome to our last before summer CMR webinar focused on access to the healthcare system and social services. Now I will give the voice to Marta Pachotka and Dominik Wach, who will be moderating the meeting, and they will introduce our speakers.
Dominik, so the floor is yours.
Okay, thank you, Karolina. As we agreed before, I'll give the first voice to Matthias. He will make a short introduction, and then I'll introduce our speakers. Matthias?
Yes, thank you very much. Yeah, on behalf of the Embassy of Switzerland in Poland, it's my great pleasure to also extend our warm welcome to everyone. I'm the Deputy Head of Mission here at the Swiss Embassy in Warsaw. And we're very pleased to partner with the Center of Migration Research of the University of Warsaw on this webinar series, Migrations in Cities, with today's event focusing on forced migrants' access to the healthcare system and social services. And what we find so interesting about this webinar series is its comparative approach. So looking at the situation in different countries. And of course, in each country, the solidarity with refugees from Ukraine has been very remarkable. And in Poland in particular, the solidarity and hospitality are really exemplary. We are especially delighted today that Ms. Ariane Merkelbach, who is the Director of the Assistance to Migrants at the General Hospice in the Canton of Geneva, is here with us today as one of our panelists, the Swiss panelists. And of course, I would like to thank all the other panelists for joining today as well from Poland and from Canada. So in Switzerland, we have now over 50,000 forced migrants from Ukraine, with an average of roughly 400 people applying for protection status every day. And I think what makes Switzerland maybe different and also unique when it comes to receiving and supporting refugees is actually the result of its state structure, with its three levels, combined with the principle of subsidiarity. So in Switzerland, you have the municipalities, you have the cantons, which I would say largely correspond to the voivodeships in Poland, and you have the central government. And the powers are basically allocated bottom up, so that each level has its own tasks. And according to the principle of subsidiarity, the central government may actually only take up a task if the cantons are unable to fulfill this task or if overarching regulation is needed. So these two characteristic elements, I think, are also reflected in the topics we are discussing this afternoon. As you will see, assistance to refugees from Ukraine in the areas of healthcare and social services is in Switzerland by and large handled at the cantonal level. And if you participated a few weeks ago, I think it was the first edition of this webinar series, you saw that things like housing of refugees is handled by the municipalities. So this just very much in brief as a matter of a very general introduction. Thank you so much to Marta, Karolina, Dominik for organizing this really excellent webinar series, and thank you so much for including us in it.
Thank you, Matthias. Thank you very much for the introduction. Yeah, as you said, the situation is vivid, it's changing very fast, and today we will try to cover two really big subjects. So access to healthcare system and also to social services. We would like to understand those fields very broadly. So today we have 4 distinguished guests, panelists, 2 from Poland, 1 from Switzerland, and 1 from Winnipeg, Canada. So the first one is Mr. Tomasz Pactwa, the director of the Assistance and Social Projects Office of the city of Warsaw. And I hope that yes, Mr. Tomasz is with us. Thank you very much and welcome. He will describe the situation in Warsaw a little bit. The second one is Ms. Anna Chatkowska, the Deputy Director of Participation Office in the city of Lublin. Welcome, Anna. She will tell us about the situation in Lublin. We have to remember that Lublin is it is the biggest city in the eastern part of Poland, so it's very, very important, and situation is regarding people fleeing Ukraine is also rapidly changing over there, and this is really important city on the map of managing the situation. Our third speaker is Ariane Merkelbach, the director of the Help of Migrants at the General Hospice in the canton of Geneva. And we would love to hear from you how you help forced migrants in Geneva and in Switzerland in general. And the last but not least, Jennifer Tomish from Canada, Winnipeg, Canada, senior psychological advisor at Newcomers Employment and Education Development Services. So also we would love to hear from you how you manage the task of supporting migrants in Canada at the city level or at the province level. So yes, we have all our speakers. I hope that everyone will be heard correctly. So Tomasz, the floor is yours.
So thank you, Dominic, for this introduction. So very briefly, Tomasz, do you have the presentation that you would like to open?
Yes, I do have.
Okay, perfect. So let's try. You are co-host. Yeah, we see it.
Can you see it right now?
Yeah, we now see the slide number 5. So we should move just to the introductory one.
So this is actually the topic.
But we still see your slide number 5. So can you try upload maybe once again? It might be something technical.
Okay, I'll do it.
Yes, now we see it, and yeah, so it should work now.
Do you see full screen presentation?
No, we see this part full screen with what you have within your comments, if there are any comments, and you know this what are the following slides.
Okay.
Can you try just to move from one slide to another, just to see, so we can be sure that you can change slides?
But it's not a full screen, so.
No, it's not full screen.
So can we carry on with that? It's just the shortage for me, and it will be difficult for me to change it, if I may.
Can you maybe send us your slides by email, so we maybe try?
Okay.
Yeah, now it works. Okay, so we see it. So you can change slides. So this is the key message. So we can go on, I think.
Okay, let me carry on. So this is at the beginning. I just want to share with you some statistical information. I know that the crisis is in progress, if I may say that. So a lot of statistic information are flying from one side to another. So this is just the scope for today, overview. When it comes to the health, Dominic said overview of the topic we are going to cover today. So number of medical consultation provided by us. So what we know, it's 7,000. How many refugees we've got at the city? Approximately 200,000 a day. We used to have 300,000. When it comes to the total number of all refugees who actually approach the city of Warsaw, it's approximately 800,000. When it comes to the psychological unpaid assistance provided by the welfare centers, it's only 500. It is because we've got additional huge support by international organizations. One of them is IOM, International Rescue Committee is the second one, and they operate not only within our reception center, shelters in other words, but also on the life within the city. When it comes to the number of people who are employed from Ukraine, the number is relatively low because it's 2,600, but you have to know that more than 32,000 Ukrainians already had a job within these 3 months from February the 24th. So it's a huge number, I would say. And then when it comes to the accommodation, as a city of Warsaw, we provide shelters for only 2,000 people right now. We used to have more, but at the moment, this is the number in our shelters. Additionally, we've got the regional office responsible for shelters, and they've got, I believe right now, approximately 6,000, 5,000 to 6,000. But in the meantime, we were providing a small service matching our citizens willing to help share accommodations with the refugees. But our assistance was much more than just application, because that kind of bottom-up approach was were present in websites. But what we do, we send social workers to see the accommodations, have a chat with the owners, and then based on that we share people. And twice as much citizens, refugees are living at the moment with that kind of share accommodations provided by us, by our citizens, with our assistance, to be precise. The last slide, I believe, related to the statistics. We have information offices, so we provide some services, so you can see the numbers, more than 300,000. Obviously, food provided by our centers, 6,000 at school, 4,000 at schools, and people also have a possibility to have a cashback benefit, and almost 50,000 people already use that. And the number of benefits of 40 Polish zlotys, it means that almost 20,000 people actually receive the benefits from the government, which is approximately 10 euros a day per person if they host them home. Another informations, I don't want to speak that much about it because I already touched it a little bit. Almost 800 in refugees hit Warsaw within the crisis. Approximately 300 who stay in Warsaw, but not only in Warsaw, in metropolitan area, and permanently we've got not more, only a little bit more than 111,000 applied for our number, registered number, PESEL, we call it. And also additional 20,000 children in schools, in preschools, but only 50%, approximately 50% applied for that number, PESEL, which is, I think, quite important. We did the research according to the institutions. We've got the welfare centers, 18 in each district, together with the nursery. 1 page is related to the nurseries in Warsaw, and also 2 pages dedicated to refugees. And 85% of the websites contains information for Ukrainian in Ukrainian, but a little bit more than 70% according to our external team who actually did the research, have the easy access to the website. So if you take into account that it was like 0 3 months ago, that is a progress. Also, we've got information online, and the one number 19115 also provides in Ukrainian with all the information, first live information dedicated to Ukrainians. Also, we also established labor office point at Chatkowska Street. And you've seen the numbers of people already get a job. The job which was done by labor office, I would say it's not more than 15,000. Other people find a job using the tool provided by a labor office or by themselves. And we still.
Tomasz, sorry for interrupting you, but we
Yes.
see that the slides simply do not change. So, or we leave it as it is because what you say is very clear. So, in fact, we do not have to have it reflected on the slides, but maybe you want to try to move or upload it once again. But this is IT stuff, so maybe we cannot just overcome this issue. Yeah. So now we are at accessibility slide. Okay, slide number 5.
So perhaps I will not change the view. So that view, as you see right now, is like fully operatable. So these are some figures. I know that after the last seminar, there was a lot of questions related to the information, precise information. So that's why I decided to put it on the presentation. So these numbers you got. And also, what is just the crucial challenge when it comes to the welfare? Obviously, we are short of housing. We don't have enough flats. Last time I said that within the first month in Warsaw, from 6,000 to 7,000 flats were rented. I'm not saying that all of them were rented by refugees, but that kind of change in the market couldn't be explained in relation with any other situation. So definitely, this is the key factor of that. Language barrier. Obviously, not everybody speaks Ukrainian. Obviously, we are now employing people. 70 social workers will be implemented, and 30 family assistants as well. Yeah, we will struggle with the economic crisis, also related to many issues. But it's not a bad. I wouldn't say that the situation in Warsaw is like a crisis situation known from Italy or from Greek, and I know it also from people who actually are at the moment from those countries in Warsaw. We had yesterday meeting. What we do when it comes to the long and medium-term places, shelters, we provide the Polish language courses, have ability to, together with the labor office, support 3,000 up to 5,000 courses, but at our shelters 500, and not everybody are willing to participate. And obviously, together with labor office, as I said, there's a specially dedicated point at one place in Warsaw, dedicated to refugees only, and it's really effective. A couple of hundred people a day could be served out there. So, and the capacity is at the moment beyond the interests. And we also have a special program for women. We also have the special program for teenagers and children. And we just recently organized the call for proposal for social housing, for social renting agency. But we haven't selected so far all the bids, but within the week we will do it. The question from organizer was, how about the cooperation with the regional and central units? I wouldn't say that there is a cooperation. We received some orders. We have to follow in sometimes the information about what could be subsidized, what could be reimbursed. but it's difficult to see the real money which are needed for integration problem. Some of the costs related with the subsidies, yes, we receive that, but without international organization, it would be difficult to implement anything. And just a few slides briefly about what are the opinion of our citizens according to refugees. So 30% of our citizens are afraid of that it will be less job vacancies than it is right now. So a clear intervention with the labor market. And obviously, a large number, more people in schools, kindergartens, and then queues for the service, medical service as well. But this is just 30%. We also ask our citizens what are the good sides of having so many refugees in Warsaw. And you see the results. 70% says more hands to job, if you more hands to work. So if you compare with the previous data, it's really impressive, and I'm really proud of that. And the second element, we are the country who actually, with the solidarity movement, and this is also one of the advantage, less than 30% of our inhabitants says this crisis gives them a possibility to help others. So this is the solidarity among the residents as well. And the incentive when it comes to the culture also has been seen by our citizens. And the last slide is also about some statistical data. Approximately 75% of our residents were involved in the process of helping Ukrainians within the first month and a half. So this research is from the previous month. And a lot of them were involved, most of them financial support, small donations, some volunteers, and they also prepare collecting goods and some meals. 70% positively see what we as a city, as a government, because people don't distinguish the differences between what government does and what city does, actually support that. And we were really surprised that 86% support free transportation and free access to the educational institutions as well. And yeah, and all actions taken by city are perceived very positive. As I said, people don't distinguish the differences between what city does, what the region does, what government does. But anyway, with such a support of citizens, we can do a lot of things, and the job is really much easier. Thank you very much.
Thank you, Tomasz, for insightful presentation. I see that we already have one question. Looking forward for more. If you'd be so kind and close your presentation. And now I would like to give the floor to Anna Chatkowska, Deputy Director of Participation Office in Lublin. Anya, the floor is yours.
Thank you very much, Dominik. Hello, everyone. Thank you kindly for the invitation and the possibility to share some insights from Lublin. As Dominik mentioned, yes, we are located very close to the Ukrainian border, and for many years we have considered ourselves the lucky ones, because we were in many cases the first Polish city for the Ukrainian citizens to ever come to. A lot of people living and working in Lublin that come from Ukraine started out in Lublin and then moved on to other places. And we have always had amazing ties and cooperations with our neighbors in Ukraine as well. And this all led to a very intensive movement after the invasion on Ukraine started on the 24th of February, particularly, of course, because of the proximity, but also because of a lot of ties that we as Lublin residents already had with Ukraine. And so I think it's always good to be able to show some data I do apologize because the numbers are universal, but the text is in Polish, but I will be translating for you. But just to give you the brief example of what the situation in Lublin is. This is a PowerPoint. This is a PDF, so I don't know how you see this. Hopefully it's okay. Okay, great.
We Anna see your full screen, just to let you know.
Yeah?
Yeah, but
Okay,
we see
wonderful.
the slides, so that's good.
Okay, yeah, okay. So let me find out how I navigate here. Okay, I will just, if I move the, yeah, do you see this?
Yeah, it works.
Okay,
Yeah.
okay. So the estimations when it comes to the numbers are tricky, and there's a lot of debate around that. But we are using the numbers provided to us by the Union of Polish Metropolises, completely understanding that this may be a bit of a stretch and exaggeration. But yes, in Lublin, we do feel that the population of our city has increased tremendously from since the beginning of the war. And it doesn't really matter if it's 17% or 10%, it's still a lot within the 3 months that has passed since the beginning of the war. So as you can imagine, addressing the needs of 10% more of the people is a huge stretch on the system of the municipality. And so we are doing our best to manage, and hopefully we are doing a decent job so far. Completely understanding that it's quite easy to provide with the basic needs. We are in Europe, we are in a safe place, there's plenty of food, there's enough room for everybody in a way. And so it's been quite easy to provide shelter and food for the people that came here and decided to stay in Lublin. But the real challenge lies ahead, and we are absolutely aware of that. And this is why the topic of this conversation today is so important, because the access to healthcare and social services is something that goes beyond the basic needs of shelter and food and the basic safety. This number says that 1.2 million of Ukrainian people stayed for a while in Lublin since the beginning of the war, and we have provided at least 138,000 of beds and possibility of spending the night. Since the very beginning, we have understood that we will not, as the municipality, we will not be able to do it on our own, in a sense that adding to what was said at the beginning about how the Swiss system is shaped as a subsidiary one, it's exactly the same in Poland. The difference is that it has never been entirely clear who is supposed to provide what when it comes to migrant, because we have never had a comprehensive migration or integration policy. And therefore, from the very beginning, at the municipal level, we have understood that the roles will not be clear, that different stakeholders and different levels of the government, be it central government or local government, will be not prepared or not certain about what services and should be provided, who is supposed to organize what and how it is supposed to function. But luckily here in Lublin, we have worked on integration issues for quite a while already. We have been developing a system of cooperation between different entities for the past, I would say, 10 years. And so I do believe that we came quite prepared, and we sensed from the very beginning what kind of a challenge will lie ahead of us, and therefore we set up a committee that's organized by local non-governmental organizations and the municipality. And together we are doing our best to create the most comprehensive system of support that's possible, creating some sort of synergy between the possibilities and the capabilities and legal options of different entities that are working with us together within the committee. And therefore, we have been able to create a system where 21 areas of operations have been developed, and we constantly work on them. And I must say, going back to the topic of this conversation, that the healthcare system is not within, well, here in Lublin, we do not own any medical facility. We do not own any or run any hospital or healthcare institution. Therefore, the entire healthcare system is beyond our area of operating and our reach, which does not mean that that we don't deal with it, because of course the migrants, the refugees who we take care of course use the healthcare system, and they use it on a very large scale, as you all know, because it is embedded in the condition of a forced migrant to get ill, to need assistance, not only on a psychological but also on the physical level. So most of our activities, they focus on providing everything else. And when it comes to the healthcare system, we provide assistance. And this is our role, and this is our understanding of how we can support the entire process. By assistance, I mean dedicated volunteers, Ukrainian-speaking volunteers. Of course, sometimes these are Russian-speaking volunteers who are there to support a person in need when it comes to going to the doctor, when it comes to booking an appointment, when it comes to undergoing treatment or medical procedures. And we are doing whatever we can to facilitate and to make it less traumatic for all the parties involved in this situation. So our role on the committee or on the municipal level in many cases is to help to find an easier procedure or route to the desired outcome. We do our best to find options of organizing Ukrainian-speaking personnel, medical personnel. And of course, we do facilitate in many cases the translation of medical documents. This is something that's extremely important, and we find it quite challenging because of the costs of such translations and because of the access to qualified translators who are actually able to provide such services. The numbers that you can see here are also the big amount of phone calls that were made, almost 15,000 phone calls that were made to the helpline that we set up from the beginning of the war. And people inquire about all sorts of things that are necessary to survive and to get by here in Lublin. And our team of now very well trained volunteers is there to answer their questions 24/7 in 5 languages. And this is how most of the people who live in Lublin gets the information about the possibilities and about the way that we can assist them. I want to add that the people that we take care of personally, I would say, as the city or as the committee, is the minority of the people, of the Ukrainian refugees that are now in Lublin. And this is something that's quite difficult for us because we are unable to access all of the people who possibly need support and assistance and help, because we provide up to 2,000 spaces, beds in group accommodation centers, and we have around thousands of persons using them at this moment. And also we have contact with over 1,500 of people that we personally accommodated in private apartments and private places. But the vast majority of the people from Ukraine, they have found a place to live on their own. So this is the challenge that we are now facing, how to reach them, how to establish contact, to be able to provide them with the services that we believe are extremely important. So this is, of course, Polish language lessons. This is these are the programs of getting to know the system, the culture, the environment where the people are, namely Lublin. These are all of the other services that we provide, such as scholarships for talented children and youth and adults, and all of the integration activities that we have set up that we believe are extremely important for the well-being of our new residents here in Lublin. One of the things that we have immediately found important is providing nutritious and a bit more healthy food for the people who stay in private families or in private apartments. This is something that we as the committee immediately diagnosed as a need, because well, imagine if you don't really have the money to get the food, and if you rely on the food provided by donation centers, well, this is not the quality type of food that you can feed your children with and, you know, be healthy for longer periods of time. So this is something that we have set up over 1,000 packages with healthy green vegetables and fruits and dairy and other products have been delivered so far, and we keep doing this every single day. And we do believe that such help is extremely important, also because it makes us it gives us the possibility to stay in touch with the people we work with. And the last thing, because I can talk forever, the last thing that I want to add is, of course, the need of psychological support that we, from the very beginning, we found it extremely important. We have teamed up with, of course, the Crisis Intervention Center, but we set up a system of cooperation with Ukrainian psychologists who are on hold every single day. There's a hotline where people can call every day, but we also provide psychological services in group accommodation services, and if needed, psychologists go to the place of residence of a person. We have established a hotline for kids and young adults, and we are now in the process of creating a safe procedure for every single person that requires a bit more specific support to be able to access the right healthcare provider and to be able to quickly organize the support that is needed. And this is probably one of the most challenging and difficult things, because as you know, the access to mental health services in Poland is extremely difficult for Polish people, not to mention for a large group of traumatized persons, very often victims of violence and war crimes. So yeah, I think that's all from me. Thank you very much.
Thank you, Anna. Thank you very much. And now we are leaving Poland, and we are moving to Canton of Geneva, General Hospice, Ariane Merkelbach. The floor is yours. You have to unmute. We cannot hear you.
Excuse me. Yeah, thank you very much for giving me this opportunity to speak about what we're doing in Geneva. So I'm sorry, because a lot of terms are in French and it was difficult to translate them into English because there's kind of terms you use only in Geneva. So I will try to do it. And if you don't understand, please don't hesitate to interrupt me. So as Mr. Detling said before, in Switzerland, we have this kind of federal level, and then the cantonal level, and then the municipal levels, and all the partners are trying to work at the different levels regarding migration and a lot of different topics anyway. But if we stick to migration, it's like that. So in Geneva, we host today 2,700 Ukrainians. It seems very few numbers regarding to the numbers in Lublin or Warsaw, wherever in Poland. But for the canton of Geneva, it's quite a lot regarding the fact that usually in 1 year we have more or less 1,000 persons arriving, and these are the big years. So it's a huge number of people in a very short period. It's the same regarding Switzerland. If you take Switzerland, usually in Switzerland we have between 15,000 and 25,000 of people, refugees, asylum seekers arriving every year. And this year we had this 54,000 in 3 months. So it makes really a huge difference to what we are used usually speaking. But the advantage of the different cantons in Switzerland, and especially if I have to speak about Geneva, is that we have the process and the laws and the rules on how to deal with migration. We had the Syrian crisis in 2015-16, so we have this kind of habit, if I can say, to welcome some asylum seekers, and if the Ukrainians are not asylum seekers, the system is more or less the same. So what they receive in Switzerland, and this is given through the federal level, is this S permit, and this S permit is given for 1 year, but can be renewed during 5 years. So one person regarding the situation in Ukraine, so this has to be that in the future, but could basically stay for 5 years in Switzerland and then get another kind of permit, which is permit B. With that permit, the person can stay in Switzerland, and that's the big difference we have with other asylum seekers, and especially the person who are temporary in Switzerland. They never get the permit B after 5 years if they are not totally autonomous in the independent financially speaking. So this is the big difference we have. Now, what we do in the Hospice Général. Hospice Général is the institution in the canton of Geneva in charge of all the social services. Not only for migrants, but also for very poor people in Geneva, for the destitute people, for the one who cannot go to the unemployment office anymore. So all those people, they come to the Hospice Général. So we have kind of two wings, one for the migrants and one for the Swiss residents. If I stick to the migrants part, we have, and this is particular in Geneva compared to other cantons in Switzerland, everything is centralized. It means that everything is done at the level of the Hospice Général and not of the municipalities. So it means that we are in charge of what is accommodation and what is financial assistance and what is health care, school and everything. Actually, we take care of everything. And for the Ukrainians, what we did, because the accommodation was the huge problem when people arrived in Switzerland, especially in Geneva, because Geneva is a very small canton. And already for the Swiss resident in Geneva, it's very difficult to get an apartment, a flat, a place to live, which is not expensive. So we tried to open as much as we could different very big places, like one at the airport, which is a huge hall, if you want, where we put 500 beds, so we could accommodate a lot of people coming in. And then we dispatch all these people in different host families. So there was a big trend of hospitality, of solidarity in Switzerland at the beginning of the war, and a lot of people announced themselves to host Ukrainian families. So now the question is, if I take Geneva, we have more or less more than 2,000 persons, Ukrainian persons, accommodated in host families, and we have more or less 600 persons who are living in our collective or some apartments accommodations. And we are very anxious regarding the future, because we think that all these host families, they will not be able to keep all these Ukrainian families for months in their house, in their flats. It's okay for 3 months, for 6 months maybe, but more than that, it becomes to be very difficult. So we are preparing the second round, if you want, of accommodation, which will be also a temporary solution, but made of office places that are not used, and that we started to renovate and transform into places where we can make some rooms and very small kitchen and sanitaries, etc., to accommodate people on the best way possible. And then the last solution are the flats, but the flats are very rare, so we keep them for very vulnerable people. So we got people with cancer, handicapped people, whatever, and all those people, they have the right to get an apartment, individual apartment, but the rest of the solutions are more or less collective solutions. So this is for the accommodation. Then regarding the other social services, so each person receives a kind of financial support. The financial support serves for what is food, basic needs. A part of this, we pay a public transport, a pass for the public transport in Geneva, and we also pay different kinds of fees for the children for the school. And we also pay all the French lessons for the adults. So there is a big program of language of courses, of French courses, excuse me, for the people from 18 years on until 60, whatever. For the children, they go to school, so they are directly introduced in the normal public school in Geneva. For the very young ones, they go directly in the classes, and from 7 years old on, they start in what we call this kind of reception class. So they start with in a class where they try to learn the basic of French, and once they can understand a little bit, then they move into another class. And for the teenagers, the adolescents between 15 and 20 years old, we have a specific program for migrants, so they don't go into normal classes because it would be very difficult, but they really have their own program to learn French, mathematics, and all this basic branches. But what we notice here is that the young people between 15 and 20 years old, most of the time, they continue to follow their own courses in Ukraine. So they're online most of the time, and they follow the Ukrainian school, which is also very good, because the day they return to Ukraine, then they will have no gap between what they left and what they find when they return. So we have in Geneva, we have now, if I'm not wrong, something like 460 children in the register in the system, and most of them in the small young classes, and the other ones in the degrees, superior degrees. Most of the people we have here are women's, I guess, like in Poland. So, and more or less women between 26 and 50 years old. They would like to work. It's difficult. It's difficult to find a job in Geneva if you don't speak French. So the language is a barrier. And it's also difficult because in Switzerland, the system of child care, and especially in Geneva, is not well organized. So we have this kind of kindergarten and crèche, but they're already full, and it's very difficult to find a place, and the places are expensive. So they have to take care of their own children, like any Geneva citizen here, and it's also a barrier for finding a job, of course. If the children are going to school, it's easier because they are taken in charge all the day long, but it's not the case for the children between 0 and 3.5, 4 years old. I know that until now, among the more than 50,000 people who came into Switzerland, only 2,000 have found a job. mainly in the Swiss-German part of Switzerland and not really in the French part of Switzerland. After that, we have also this, what we also did at the beginning on, and I heard you did the same in Lublin, is a website for Swiss citizens, for Geneva citizens, and for the Ukrainians, so, and a hotline. And we had also thousands of phone calls and thousands of people going to the websites to get all the information in the different kind of topics, going from the access to the permit until the healthcare and regarding all the activities for the children, the scholarship, etc. in Geneva. So this had a big success too. Now, regarding the healthcare, because I was asked to speak a little bit about the healthcare, so I have to say that in Switzerland we have an efficient healthcare, even if expensive. It's a good one. So what we have, this is very specific to Geneva. It's a kind of convention with the University Hospital of Geneva. And in this hospital, there is a department and a unit called Migrant Health Program. And this program we work with very closely, but this is not only for the Ukrainians, it's a program that pre-exists for a long time, because we work for all the migrants with that program, and each Ukrainian and each asylum seekers which arrive in Geneva receive healthcare insurance. And with that healthcare insurance, go to this migrant health program. And in that unit, they receive all persons arriving. So all the persons who need healthcare have to meet doctors in this unit. And from that unit, they will be dispatched to a generalist or to a specialist regarding the pathologies they have. But the generalist, well, we call it the family doctor here, is a person. We try to find persons who are speaking the same language as the Ukrainians or as the asylum seekers. Well, it's not always possible. Most of the time, we can find people who have a language which is the one of the migrant too. So this is very facilitating all the medical process. And since the beginning of the war, we already had more than 3,000 consultations. So I think it was 3,500 consultations at the hospital. So it means more than a consultation per person. And for the children, it's the same. There is a service, a medical service in the department of the schools, and each child who goes to the school has a medical visit, and then can be oriented to the right practitioner if needed. We have also a special unit for the children, the teenagers between 12 and 25 years old. I think, yeah, it's between 12 and 25, and they concentrate all the assistants around nurses, psychiatrists, psychologists, pediatricians, gynecologists. You have really all different branches which are represented. And this is also very useful for all the children who have been traumatized and who have a lot of different kind of problems. And then they get medication, so it's part of the same systems of health insurance. They can get in specific pharmacy, how you call that, places where you buy the medicines and they go there and get the medicines. So this is the system we put in place a long time ago, and that works really well for the Ukrainians too. The challenge, I would say, in Geneva with the Ukrainians crisis was to get the staff in all these different branches, to get the staff to get the staff who could also speak in Ukrainian or in Russian, and to put this on, to implement all this very quickly, because we had no time beginning. We had more than 1,500 people coming per day, and we had really to rush to set up all this very, very quickly at the federal level and at the canton level. So, and this remains a challenge because as we have always more people, we need always more staff, and we have the impression that now it's getting difficult to have more social workers and to have more interprets, etc., etc. So this remains a big challenge. So I think it's what I could say. Maybe one word more about I talked about the job, so it's okay. Thank you.
Thank you very much, Ariane. Thank you for the perspective from Switzerland. And now we are moving to Canada. Jennifer from NEEDS, the floor is yours.
Hello, thank you for allowing me to be here today. I have a presentation I'm going to share.
So you have the presentation. Can we try? Does it work? Please try the full screen option. Okay, try to change the slide to another one. Yeah, it works. So we can go on. You have 20 minutes.
Great, thank you. So before I begin today, I would like to acknowledge that NEEDS Inc. is located on Treaty 1 territory, and it's the traditional territory of the Anishinaabe, Cree, Oji Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. So NEEDS Inc. is a one-of-a-kind nonprofit charitable organization in Winnipeg, Manitoba, Canada, established in 1999 by immigrant women. All of the services that we provide to newcomers are free. Our mission is to provide accessible services and support to immigrant and refugee children, youth, and their families. Our goal is to enhance the integration of immigrant and refugee children and youth into Canadian society by providing employment, education, social recreation programs to develop the life skills that they need to be successful. Each year we provide support to over 2,000 clients. NEEDS Inc. receives funding through Immigration, Refugee Citizenship Canada, the province of Manitoba, the Winnipeg Foundation, among many others. NEEDS Inc. also receives funding through the Public Health Agency of Canada to expand our current mental health supports through our enhanced wellness for newcomer and refugee children, youth, and their families. It is important for us to acknowledge our funders because without them, we would not be here today. So some of the services that NEEDS Center provides are an introduction to Canadian education program, which is a school preparedness program for newly arrived refugees awaiting placements in the school system. Our settlement workers in schools, which support children, youth, and their families for their first 18 to 36 months of arrival to assist with integration into a new school, community, and connecting families to community resources. Our employment services, which help newcomer youth aged 16 to 29 develop employability skills to enter and successfully integrate into the Canadian labor market. I'm going to focus most of my presentation today on some of the psychosocial supports that we offer to newcomer children and youth. So our focus of the psychosocial support services is to provide newcomer children and youth with additional support during their participation in NEEDS activities, to enhance success and to ensure a smoother transition during their settlement and integration into Canadian society. Psychosocial supports are incorporated into all aspects of Need Center programming. Psychosocial support components include assisting children and youth in recognizing their abilities, capacities, interests, goals, and personality to reach their fullest potential. We know that children and youth are extremely resilient and come with many skills, strengths, and abilities. What we do is we focus on their strengths rather than focusing on their deficits. We also assist children and youth in exploring their feelings and emotions and exploring healthy coping strategies. We teach youth about the survival responses, flight, flight, and freeze, and teach them about healthy coping strategies and how to self-regulate. We also help children and youth find ways to grow personally and socially by increasing their pro-social skill development and finding ways in which they can take on leadership opportunities and pushing them out of their comfort zone when appropriate. We also provide opportunities for comfort and hope by validating their experiences, honoring their roots and values and traditions, and allowing youth to have a voice. We also connect children, youth, and their families to additional resources in the community. We provide Circle of Security parenting programs to parents delivered in first language. Circle of Security is an early intervention program designed to strengthen the relationship between a caregiver and a child. It is used internationally, and we currently deliver this in 9 different languages. We also provide consultations to the greater Winnipeg community on challenges and unique needs of newcomer youth. This might include other service providers, education staff, community groups, and ethnocultural communities. Some of the common topics and areas in which we provide either one-on-one or group support is around conflict resolution, managing trauma responses, flight, fight, and freeze, family conflicts, ongoing dysregulation, and supporting with and teaching children and youth about self-regulation strategies, difficulty in coping with change. That could be a new country, a new school, changes to their environment that has an impact on them, anger management and identifying anger triggers, ongoing bullying either in the community or at school, stress management and coping skills, alcohol and drug misuse, gang prevention and gang involvement, and suicidal ideation or self-harm. Trauma-informed care and being trauma-informed is at the center of what we do, and it's incorporated into all the services that we provide. Trauma-informed care can be viewed as an overarching philosophy and approach, or even as a set of universal precautions designed to be both preventative and rehabilitative in nature, in which the relationship among environments, triggers, and perceived dangers is noted and addressed. Being trauma-informed does not mean we are treating the symptoms of trauma. Rather, we are being mindful that anyone that we come into contact with has experienced the trauma. Trauma-informed care is based on the understanding that many individuals have suffered traumatic experiences, and the provider is responsible for being sensitive to this fact, regardless of whether this person is being treated for trauma or not. Workers should initially approach all of their clients as if they have a trauma history, regardless of what services they are being seen for. So why does this matter? Our goal is to teach children to become trauma-informed. Being trauma-informed is a shift from thinking, what is wrong with you, to what has happened to you. We begin by focusing on trauma-informed principles as a way of creating safety with the children that we work with. And we do this by the relationship that we develop with them. The principles of being trauma-informed also include helping children realize that they have a choice and to feel like they have a voice. We want them to know that we are trustworthy, and we do this by being transparent about what we are doing and why. Additionally, as staff, we want to be aware of any cultural, historical, or any other gender issues that might have an impact upon ourselves and other children and youth that we might be working with. We also want to ensure that the activities that we are delivering are culturally safe, appropriate to avoid re-traumatization. So I was also asked to share some recommendations and strategies on how other service providers can provide support to migrant children, families, and youth. And the first one is interpretation service. So we know that sometimes families might come with English or other region speaking languages, but we always want to make sure that we have access to interpretation supports and that we have materials in their first language. Using a client-centered approach, so meeting clients where they're at, providing supports and referrals to where they feel like they need supports to, not where the service providers think that they need supports to. Being realistic and not making promises. Leaving behind and coming to a new country is hard. It may take time to find housing, employment, getting settled, and service providers should be realistic in setting these expectations. Do not make promises, especially ones that you cannot keep or ones that you do not have any control over. Validate and empathize. Listen to the stories and experiences they share. Validate their challenges, their worries, and their struggles. Normalize support services to reduce stigma in accessing supports. Emphasize the importance of asking for help. It's okay to ask for help, and it does not make someone weak or unwell. Practice power with and not power over. People are the experts in their own lives. We are there to help guide, provide choice, ensure they understand, and advocate if they need. We are not here to tell them what to do or how to do things. And providing support and helping navigate the different systems. So education, healthcare, social services. Navigating a new system can be challenging. Something as simple as how to apply for certain documents or navigating the healthcare system can seem daunting to someone that is not familiar with the system. And finally, some additional considerations or recommendations are developing an assessment tool to identify in which individuals or families need some extra support. Some of these areas might include education, employment, housing, basic needs, social supports, or goal setting. These tools can also aid in identifying additional referrals that needed to be done and to which organization, depending on the types of services you provide. Developing a database of readily available referral resources, including crisis supports. Having a handy list of trustworthy organizations that may support in finding housing, employment, mental health services, or other services that the individual needs. It's also worth having a list of emergency supports, such as emergency shelters, food banks, crisis phone numbers, just in case your agency is not equipped to deal with some of those situations. Offering transportation. This reduces one of the barriers to accessing services. Some examples might be providing bus tickets, vouchers for taxis, doing home visits. And training for staff and service providers on trauma and being trauma informed. Trauma is a unique experience and can manifest at different times and at different intensities depending on the individual. Thank you.
Thank you, Jennifer. Thank you all for really great contributions. And now I would like to ask Marta to lead the Q&A section. Marta?
Thank you, Dominic. So as you see, this means co-coordination, co-moderation of the event by the two of us. So it's not only that we together contribute to media in Poland, but also we try to co-coordinate some events. So Dominic, thank you very much. We went just through 4 speeches this time. We had only 4 speakers, but this was our intention to give really more time per one topic, as we know that what we understand as social issues, social policy is very broad. So for example, in Poland, when we think about the social policy, social support, it covers everything. And we saw it today reflected in some presentations, some contributions. So it might be about the healthcare issues and the access to healthcare services. It might be about accommodation, housing, social benefits, and psychological support. So as of now, I would like to express my gratitude to 4 contributors we had. So we had 2 of them from 2 big cities in Poland, so Warsaw and Lublin. Both cities are very important in terms of receiving the current forced migrants from Ukraine. Lublin, just to give you, if you are not from our part of world, so Lublin is the city not so far from the eastern border, the one we have with 3 non-EU countries, so Russia, Belarus, and Ukraine. So this is one of the transit countries, but also one of the cities, but also one of these cities where many people decide to stay because it's so close to Ukraine. Another city that is important in Poland is obviously Warsaw, the capital city. Here many people decide to stay for much longer because the labor market is bigger, the access to, for example, a primary education for kids is easier. Then we got two examples from two different regions. So we had Switzerland, because this is one of our partners during this series of Center of Migration Research webinars. And here we've learned a lot about the developments in Geneva, so also very big city. And as I've noted during Ariane's contribution, it's not only about us, I mean, Polish people, Polish service providers to learn, but it might be, in fact, mutual learning process because Geneva also is facing different challenges, for example, in terms of accommodation. So it's not only the challenge for us in Poland. And then finally, it's Jennifer that is from Canada that provided us with a good overview what her institution is doing. And what is interesting, if I'm correct, Dominic, you can correct me and the speakers, we had in fact two types of contributions showing also two different types of service providers, because the three first speeches were about the actions taken by the, let's say, more or less local governments we have in Poland and in Switzerland. But then Canadian perspective was stressed from the perspective of, let's say, third sector / private sector. But we know that this is typical for Canadian reception and integration system. And here a very personal note regarding the fourth speech. So the institution we call the NEEDS in short. I would like to express my gratitude to a good colleague of mine from Canada, Margaret von Lau, that who is the executive director of the NEEDS, and we know each other from one of the migration conferences, Metropolis in Canada. So this is what I have in my mind. And now, as far as I know, Anna she has to leave us, and maybe she even left us. So there will be no specific questions to the Lublin case study, but then we have Tomasz, and it's the second time he's with us, so we are very happy. So I would like to look at both chats, the one we have here and the one we have on YouTube, Facebook. So for sure, there is one question that was asked at the very beginning. So I will leave it as an open question, but I think it was addressed mostly to you, Tomasz, so you can try to answer it as the first one. So this is the question by Dr. Tanya Herring. She's a colleague of mine from the International Political Studies Association, and her question is, can you speak to the turnaround time for immigration papers for these groups? Here, I think, Tanya, that you have in mind forced migrants from Ukraine. For example, US has announced the temporary protected status for 18 months since the 1st of March 2022. In the UK, what is the progression time frame in weeks 6, 8 or longer for refugee status and humanitarian protection, as I'm sure it impacts the ability to work as well as acquiring a residence. So I would make this question shorter. Tomasz, what is more or less the time that processing different types of protection statuses we have in Poland, in Warsaw, because and also you can add how it is with temporary protection for Ukrainian citizens and non-Ukrainian. So very briefly.
Okay, thank you very much. Thank you for the question. In fact, these two groups, so the clarification if it is related with Ukrainian or not is accurate in that case, because we've got a special legislation dedicated only to Ukrainians, people who actually leave Ukraine and not Ukrainians, those who actually leave the crisis. And then and it's not related with the status protection and the humanitarian protection and the asylum status, because they not apply in that line. Usually the normal procedure takes 6 months. sometimes even shorter, sometimes longer, but this is usually time this is a time for procedures. However, when it comes to that crisis, we've got a special legislation. So the only thing they have to do, they are obliged to do, they have a parcel number, identification number, in other words, and then they have a full access to the social security, healthcare, welfare system, and education system, and obviously labor market. So so this is I'll try to answer that way. Thank you.
Thank you, Tomasz. Do we have other questions that someone would like to ask directly? If not, I will move to the questions that were proposed by my colleague from CMR, and at the same time, the co-coordinator of the whole series of CMR webinars. So Karolina Łukasiewicz question is, are city administration workers in Warsaw getting any trainings on how to serve clients with trauma? For example, from Ukraine. Tomasz, do you have any knowledge in this field? So are there any trainings provided for you, for your colleagues, for your staff? So is there any way you can be prepared, for example, how to work, how to receive, how to provide support to Ukrainian forced migrants, for example, with post-traumatic stress disorder?
In fact, no. The cooperation coming from the welfare offices and social workers were not covering that kind of intervention previously. So it was a dedicated unit responsible for the cooperation with the refugees. And there we've got the trained staff. However, when it comes to the shelters, we are about to organize trainings, plus most of the integration programs are provided by international organizations, and they've got the know-how how to deal with the refugees, and also provide the courses of the other organizations, because they usually are umbrella organizations, provide them courses, and then at the end of the day they provide the service towards children and adults. This is basically how it works.
Thank you, Tomasz. So now I would like to move to Geneva for a while. So Ariane, can you comment a bit more about this accommodation issue? So if we take into consideration, let's say, medium-term and long-term perspective of receiving forced migrants from Ukraine. So for me, medium-term in Poland, it's as of now 18 months, because this is what the law for Ukrainian citizens provides as a legal stay for them. Then more than 1.5 years is for me long-term and maybe integration. Is there any official approach you apply in the city hall, at the local government level, how to understand medium-term, long-term? Are there any special plans, for example, what to do with this access to accommodation and education? Because I think this is really crucial. Healthcare, it can be done because not all the people at the same time need medical services. The same with labor market, if it's well organized. But housing, for example, from the project we did together with Tomasz and Dominik a few years ago, this was a test project regarding the integration of forced migrants into labor market in Warsaw. We've learned that it's not the labor market that was crucial. What was crucial was access to housing, giving the people the feeling that they are safe and that they can focus on, for example, Polish language courses, requalification, and so on and so on. How do you see it, and how is it in Geneva?
Yes, it's a challenge, as I said before. For us, the medium term is maybe until the end of the year, and after that we are already in a kind of long term. So what we urgently implemented was this big hall near the airport, where we have this kind of rooms in a very big hall. Then the second phase are the renovation of all these places where we have now offices, unused offices, And we got also from the local government the authorization to make all this renovation without passing through all the system, which is quite complicated in Geneva, of authorization. Usually to get a building transformed into something else, it can take 2-3 years at least. So with the how can I say, with the decision taken by the local government, we can pass through all this authorization, and the only thing we have to be very aware of is the security, of course, human security and fire security, etc. Once this is done, then we can renovate and then we can accommodate. And we have at least 8 different places like this in Geneva. All these places can accommodate more or less 1,000 persons. So this is the second step. And after that, to be on a more long-term phase, then we need to construct a new collective center for migrants. But this is very difficult because as soon as you start a construction, first you need the place, the field to construct it. And as I said, Geneva is a small canton with a lot of people. So even for the local people, it's difficult to find a place or to construct anything. So we have to get this this land from the government, and then we have to construct. And as soon as you want to construct something, you get a lot of opposition from all the people living around because they don't want to have a big center in front of them. So it's always, okay, you can construct, but please, not in my backyard. It's really that. So this is the third challenge we have too. It's to identify the places where we can construct for the long term, because we know perfectly that all the people here are not going to find an apartment, and individual apartment. This will be maybe possible for the people who are going to find a job and who will have a good salary and can then afford the price of the apartment. Just as an example, all the people, other refugees we have, even if they work until they get an apartment from the social services, which means an apartment which is a little bit less expensive than the real ones, it takes at least 3 to 4 years. So it's really a question of having the salary that gives you the opportunity to have your individual flat in Geneva. So it's why we focused on this emergency housing accommodation, then this second phase, which is the very temporary phase in the renovated offices, and then the third one, which will be the construction of new collective centers. But it's also preoccupation and it's a big concern of the federal state. We have a meeting regarding this in 3 weeks with the federal state, because all the cantons have more or less the same problems. It's emphasized in Geneva because the canton itself is very small.
Thank you. So now we have 3 questions. Very briefly, the first question will be from Carolina to our colleague from Canada, Jennifer. So this is it. Are you using cultural humility training for service providers serving traumatized forced migrants? What kind of trainings you are using? So can you please address this issue if it's the case of your institution, Jennifer?
Yes, we do making sense of trauma training to all of our staff. We also do training specific to the needs of the clients that we're serving. So for example, when we had the Syrian influx, we learned a lot about the different, like the background and their cultural history and all that stuff. And also we're now doing that with the Ukraine so that we can make sure that we are culturally sensitive in supporting them in the needs that they have.
Okay, thank you. And now I know that Tomasz, he would like to ask the question. I don't know what kind of question and who is the target, but Tomasz, The floor is yours.
In fact, I'm checking if everything is recorded before. So this is
It's
just
recorded and it's streamed. So be
Okay.
careful with the questions.
Okay, so my provocative question would be, what do you think? I'm addressing it to the speakers. What is the key factor of the successful integration? Is it possible to integrate? I mean, I'm not going to go into detail when it comes to definition of integration, but I'm speaking about your feeling. Do you feel that it's possible to fully integrate or integrate people who are staying in shelters, getting a job, and then by that fact being integrated and then finding a job, and etc. so on, without this period of having social houses? Because now we are struggling with the crisis of a limited number of flats. So my question goes in that direction. Perhaps you've got some suggestions to us. Thank you.
Thank you. So who would like to address the question? Jennifer, Ariane? Any comments are welcome. Okay, Jennifer, you are the
Yes.
first one.
So I've been in the settlement sector for about 13 years now, and I can say 100% they do integrate. Sometimes they do require a little bit more support and guidance, but they do end up in the school system, they end up finding jobs, they end up finding permanent housing. And yes, absolutely 100% they do integrate.
Okay, Ariana, something from your side?
Yes, well, they don't all integrate. It depends on what we mean by integration. But if I look at Geneva, depending on the nationality of the refugees, they don't all integrate themselves in the society. Some of them, yes, but some of them, no. Who integrates are the children, because the children, as soon as they start at school, they're in the system, and it's kind of second generation, and those ones, they can integrate and they get trained and they get a job, etc., etc. For the parents, very often it's very difficult, and it's even more difficult if the parents arrive in Switzerland after 35 years old. So it's getting a job is more and more difficult, because as long as you don't speak French, you can't get a job. And learning French is not easy. It depends on your the level of the level of scholarity you had in your own country. Sometimes people who are coming here, at least they had quite no school. Some of them they don't even speak right in their own language, or an alphabet. So it makes very big difference between people regarding where they are coming from, the age, and the education they receive in their own countries, etc., etc. And there is no, in Switzerland, it's very difficult to find this kind of little jobs, small jobs. Even if you get one, you don't get out of the social services, because then you have to pay your health insurance, which is quite important, and then your flat and your rent, and it's very difficult if you don't have a good salary to get out of this system. Even among the people, what we call here the working poor, they people both are working in a family and they have a salary, but even with that, they need social services. So it's why it's not easy. It's not easy.
Thank you, Ariane. So yeah, Tomasz, please.
If I may, a small amendment. What do you feel when it comes to the people who have a high quality job, who used to have a high quality job? Do you feel it's even worse for them to get a job in Switzerland? Because for
we are in
instance, with hardly or without ability to speak French. Sorry. Am I lost?
I'm sorry, but I didn't hear you.
You were lost for 2 seconds, 2 to 3 seconds.
Yeah.
So you can repeat the question. You've just mentioned, about this moving
Hello?
from this. Yeah, we can hear you. You can hear us?
Yes, I can hear you. I was speaking about the high quality jobs,
Yeah.
people who are living in, for instance, Ukraine for many years, but probably don't speak French. It would be difficult for them to adopt themselves for the reality in Switzerland. Do you see that problem, or doesn't matter about the quality?
No, I think that people with a very good education, and we see here there are a lot of women of very good education, and they will find a job, especially in the international firms or in international organizations, whatever. If they speak English in Geneva, it's quite easier. If you don't speak English, but then it depends on the job you had in Ukraine. If it's a job that for the one you need to speak French, then it will be more difficult. But as long as you can work in English, then you can get a job. And there are also branches where the Swiss firms are looking for people, especially in IT systems and the digital communication, and all this is very demanding. And those people from Ukraine, they have all the skills that maybe we don't have here. So depends really on the background.
Tomasz, are you satisfied, or do you have any additional issues? You can comment if you want.
No, I'm satisfied.
I like this sparring activity, guys. Okay, so now we have one more question from my colleague Tanya. So can you elaborate? I think that this is the question to all of you. I mean, Jennifer, Ariane, and Tomasz. Can you elaborate further on safeguarding matters? For example, unaccompanied children, background checks on places and people where there is a temporary placement. Are there safeguarding follow-up processes? Unfortunately, after these types of conflicts take place, we mean here the war in Ukraine, we then hear about the gaps in safeguarding, system from providers and come to help us. So to make this question very brief, so thank you, Tanya, for stressing it. What is the situation in these 3 countries receiving now, especially forced migrants from Ukraine, with let's put it in this way, the situation of minors, but also, for example, gender-based violence, if you know about any cases. So I would like to start this time with Jennifer. What is the situation, if you know, if you have any contact with this kind of cases in Canada?
I do not know of any Ukrainians coming as minors, but it has happened in the past with other refugees seeking assistance. As far as I know, they are placed within our child welfare system once they arrive, so that they have that support until they reach the age of majority.
And cases of abuse were reported, as far as you know?
With Ukraine so far?
Yeah,
no.
for example. Okay.
No, not that I'm aware of, no. Okay,
thank you. Now, Ariane, anything from Geneva, but very briefly?
Yeah, we have unaccompanied minors. Most of them are hosted by families, Ukrainian families, but we have a very protective system. It's the Service of Minor Protection, and they, how do you say that? They take cases. Yeah, they take all the cases and they go to each family and to each child to see how the child is treated, etc., etc. And they are all registered, what I was looking for. And we also have a center, the Hospice General has a center for unaccompanied minors in general.
Thank you. And finally, we'll get back to Tomasz. And I see also that our colleague from UNHCR, I think, joined us. So maybe Maria later will add something. So Tomasz, now a few words from you.
We've got a huge number of refugees in the city of Warsaw. So definitely at the moment, we see some problems to be covered when it comes to the people with disabilities, especially if the disabilities are like combined. And also, even if we've got a service, it's a problem of who should cover the costs, because there's actually a gap between the different regulations. So we actually don't know who will cover the cost, and the costs are really high. So this is actually the problem. This is actually, you hit the nail right now in the problem, because we are trying to sort out the problem. Anyway, to make the story short, huge number of refugees, we concentrate on the huge numbers. So we have to cover with the social service of the, let's say, minority with this specially dedicated problems. It is behind us to be covered. Thank you.
Thank you, Tomasz. So now I will be a bit, how to say, provocative, because I see because I'm just looking who is joining, who is moving, who is returning back, and I see someone called Pamuła, and I'm guessing that this is our colleague Maria Pamuła from Polish Office of UNHCR. I don't know if Maria, you can at least join us with your voice and tell us a few words. What is the state of play in terms of refugee response plan in Poland, and the mandate within the mandate of your office?
Hi, yes, it's
hi,
me.
Honey, hi. It's nice to have you.
I was trying to be a little bit undercover, but you spotted me.
Not with me, sorry.
Yes. Then I'm in a bit difficult position because I'm not in Warsaw anymore, and I'm not dealing with the country-wise issues. I was moved to Krakow, and I'm here in the local office covering south of Poland. But responding to your questions regarding refugee response plan, yes, we had a big launch on Tuesday, and it's now official. It's available on our website, and it's available to be looked at. And it's a document that actually proposes a number of activities within so-called sector areas, so separately for health issues, separately for children issues, and so on and so on. We have worked it with our partners, with the Polish government. They provided some comments also, and we hope to follow the guidance. It's quite a large document, and it provides a number of recommendations. But I also saw today that the so-called white book of recommendations after the Wrocław's roundtable was published. I don't know if it was mentioned already today, because I unfortunately I had a different meeting and was able only to join shortly, not so long time ago. So this white book of recommendation comes from the field, from the local governments, from local organizations, from experts, also state experts, and the social workers, and the volunteers, and the informal groups. So it's a really, really big document covering a number of areas. So along with our response refugee plan, I would say that there is a number of recommendations. I can see that there are questions regarding unaccompanied children in the chat, and I know we are discussing also health issues today. So both very, very important and valid issues. Regarding unaccompanied children, we have raised a number of times our worries with regards to the situation of those persons, of those kids in Poland. I know the situation is improving. We have, the Polish government is discussing with the Ukrainian government safety solutions, for example, the registry of unaccompanied children. The system is being adapted to host the children. We have the institution of the temporary guardian, and so on and so on. So I believe the number of solutions are there on the ground. However, we still see the gaps in implementation. We had a training workshop last week on children's rights, and we discussed, among others, the guardianship issues. So I would flag a big red flag here with the guardianship issues, with this specific situation of Ukrainian children and this temporary guardian, and its obligations, oversight of the temporary guardians on the qualifications of those persons should present, as we know now, the courts are appointing mainly those who show up with the children, so no qualification test is done. Oh gosh, I would have a lot of a lot of issues to tackle. So going back, yes, we have refugee response plan with a number of recommendations, including the one on unaccompanied children. We're looking closely on what's happening with the implementation of the special regulation, on what's happening with the registering of the unaccompanied children in Poland. We are looking also at what's happening with the further movement. We know that there were some initiatives to transfer unaccompanied, oh my gosh, lovely, of transfer of unaccompanied children to other places. You probably heard about the story of Angel of Mostar. So these are all the issues we look at. I'll be happy to brief you more or to send you the links. I mean, I'll put in a chat the link to the refugee response plan.
Thank you.
So,
I hope that you don't mind that I asked you or encourage you to just contribute, because really your voice from the field is very appreciated. And as you said, there are so many developments, meetings,
and so many aspects also, yeah.
On that even myself trying to cover all of them, being involved in different mailing lists, I'm not able to, to explain everything that is going on. What I can advise also to those of you that are really interested in health-related issues, or for example, gender-based violence or minors, I've just copy-pasted the website of the UNHCR in general, devoted to the situation in Ukraine, but also in the receiving countries. So this is fully based, this is the operational portal of the data of UNHCR, very often based on the governmental sources, where you can check on the daily changes in terms of forced migration flows from Ukraine, but also about internal displacement. Also, if you roll down your screen, you can find the different thematic reports and announcements and updates, including English. So it's, for example, divided by the topics, the thematics we have, so health issues, basic needs, and so on, but also by country, the countries. And I really recommend to look at it. And I'm also using the sources, for example, to develop some overview of the current developments in Poland during different conferences, because the problem that we have, not only at the cities level or rural areas level, but also as the country, is the gap in data. So we are trying to estimate how many people we received, but also how many of these people will stay and will be the target of our actions as the local government, actions as the NGOs, but also as international stakeholders like UNHCR. So we need this information to design and implement our public policies, but also then count the money, because this is always also about the money, how to finance it. Now we are happy because there is a kind of progress at the EU level with the money. I don't know if it's good or bad, but there's something going on. So let's see what the future will bring. Maria has just posted this link to reporting UNHCR. Also, I posted, yeah, you want to add something, Maria?
Yes, just one more thing. We are also co-chairing together with UNICEF the working group on the child protection of children. So if anyone is interested in joining the group, I'll leave my email address in the chat, and please contact me.
Wonderful.
It's on bi-weekly basis, so it's it's not too much time taking. It's just 1 hour, but it's an overview of what's happening in the country.
For those of you that don't know, and what really I appreciate, in fact, I see from all the international stakeholders that we have now in the field in Poland, UNHCR as the key one, because it's UNHCR that provided from the very first days the discussion on this regional refugee response plan. But also, I think that this initiated the cooperation with Polish NGO Forum that is co-coordinated by Polish Humanitarian Action. There is a huge mailing list where everyone can be involved to receive an updates on a daily or weekly basis. So this is really an open and inclusive process. There are also international non-governmental organizations, not only specializing in migrants, but also working simply in this humanitarian sector. So what's going on in Europe, in one of the member states nowadays, is something what usually UNHCR would do, let's say, outside of Europe. And now we are, in fact, Europe became, if I'm correct, the main receiving region in terms of forced migrants, if we take into account this international forced migrants with the exclusion of the internal displacement. You have also an email to Maria. So I think that we should finish slowly because it's 10 to 4. So thank you very much for joining this session. Especially many thanks for our guests, those that were in program, but also those contributors that were not in program, but just then contributed by questions or by statements like Tanya or Maria. So what I would like to say on behalf of my team, so the Polish Migration Policies Research Unit and colleagues from CMR, is that this was the last seminar we had before the summer holidays. And after summer holidays, we will be back. Still, we have to think about the topics. So, you know, to be really up to date and contribute to the discussion that we have as researchers, policymakers, and practitioners. The meeting is recorded. The meeting will be posted on our YouTube channel. Also, if someone is interested, we got the slides from Tomasz, especially for those that, you know, are interested in the situation in Warsaw. So you can email us. I can put my email in chat box, so you can email us and we can send you these slides, but please do not post them anywhere. Let's use them for your private use. Yeah, Dominic, would you like to add something? Because, you know, I have this impression that I dominated the meeting during the second part.
No, thank you. I think that we covered most of what we wanted to cover, and thank you very much for really insightful presentations. It was very interesting in my opinion. So hopefully after the summer break we'll have more opportunities to meet, to exchange our knowledge. And once again, thank you.
Thank you very much, and also many thanks for our colleague Matthias from the embassy. So as you see, Embassy of Switzerland is very open, based in Poland, the office is very open to cooperate. So we hope that they will stay with us, and also the Union of Polish Metropolises. Yeah, so this is it, the dialogue that we have, you know, not too very formalized, not too academic, too research oriented, but rooted in research and translated into practice. This is what is behind these meetings we are having. So thanks a lot. There are many nice words going on chat. So if it's useful for anyone now or after the session, that's great. So thank you guys, and see you after summer holidays. Bye.
Thank you.